The job role of a doctor is far superior to the job role of a pharmacist. Pharmacist is not a high-paying job role. If I want to move abroad, let me just do B Pharm or M Pharm and just directly fly to Los Angeles. There has been a lot of misconceptions around the field of pharmacy. Together with me is Dr. Dharmesh Modi, who is the Dean of Silver Oak College of Pharmacy and Silver Oak Institute of Pharmacy and Research, and we together will be debunking the myths around pharmacy. Hi, I am Rashmi Sharma. I am the head of content at Silver Oak University, and I welcome you to episode 8 of Vartalap, a special podcast series brought to you by Silver Oak University. Namaste, sir. Thank you so much for being here with us.
My pleasure.
Sir, I'll start with a very basic thing. There is a lot of misconception that goes around pharmacy. Do you think that these myths really have some value?
The pharmacist, being a member of the healthcare team, has been recognized very well after the post-pandemic. I can say that, well, let's say, if we talk about the Silver Oak University, we offer the wide range of program that starts from the diploma, even the degree in the pharmacy. After that, there are a lot of wide number of or the vast possibilities available. Let's just start with the diploma pharmacy. If the person is completed a diploma pharmacist, that's a 2-year program. That person can start his or her drugstore. That person can work as a pharmacist in the local or the government hospitals. After the completion of the Bachelor of Pharmacy, yes, the whatever the duties or the roles, the responsibilities that are to be performed by the diploma, that will be there. But in addition to that, the pharmacist is a must as per the Schedule M requirement of the GMP. So the pharmacist can work in any of the pharmaceutical manufacturing company, even the bulk drug industry, even the pharmaceutical testing industries, as well as the pharmacist can work or apply as a drug inspector.
So all these avenues open up after somebody has done their diploma, right?
Yeah, the last one was, that is, these are available for the B Pharm. But for the diploma, yeah, there are only the couple of options available. But that are not also, you can not say that are not a common one, because a layman cannot do that one. A diploma pharmacy person, after the 2 years of study, yes, that can become a drug entrepreneur as well.
Even if somebody has 2 years of time after they complete their 12th, they could open up a drugstore of themselves.
Yes, absolutely.
Right. How does the job roles change after one does diploma versus how it changes when one does their bachelor's, B Pharm, and how it changes after somebody has done master's, which is M Pharm?
As you are going from the diploma to degree and we are going to the master's, right? So your specialization is going to be narrowed down. So diploma, when you are studying the diploma, you are studying the drug at the superficial level. But at the B Pharm level, you are going in the depth. And at the master's level, yes, depending upon the specialization choose, you can go into that depth level as well. So yes, once you are going from diploma to master's, yes, you become a specialist. Like the doctors, what we are doing MBBS and then doing the MD and then doing the specialist. Right? It is like the same scenario in the pharmacy field as well.
One of the misconception is that the world can still survive without pharmacists, but it cannot survive without a doctor. So do you think the role of pharmacist is equal to or maybe superior to that of doctors?
To be very honest with you, in the North American and some of the European countries, the pharmacist is given the equal or sometimes the more weightage over the medical practitioner as well. Because the medical practitioner only will diagnose the disease or the disorder and they will just prescribe the medicines. But who will make the medicines? How you are supposed to take? When you are supposed to take? How you maintain that effectiveness of the medicines so that it will reach to the site of the action without any side of the adverse effect. That is all things going to be decided by the pharmacist. Pharmacists even can substitute that medicines. Pharmacists can make that medicines pocket friendly with the same effectiveness. So this is the much more vital job role. If the doctor is only writing on the paper and if pharmacist is not able to manufacture the dispense, then how are you going to get that medicines? Right, so I can understand that one. Yes, the pharmacist is much more vital, or it is equivalent to that of the medical practitioners as well.
So you were talking about, we have talked about the job roles, right? Let's just also debunk one of the myths, which is that if I talk about somebody enrolling for a particular course after their 12th, they generally go for pharmacy because they think that, the fees and the duration of pharmacy course is going to be lesser as compared to doctor. Like if somebody goes for MBBS kind of course, because the fees is going to be higher and the duration also is going to be longer. Is that a myth or that is a reality?
If you are going for the pharmacy field and if you are compared with the medical field, it's a contrast. Both are the different thing. Because see, when we kept the patient as a center, what is the meaning of the word patient? Patient means a person who is abnormal. Okay, so that is going to be come into contact with the three person. The first one is the medical practitioner, second the pharmacist, third one the nursing staff. Right. So if you talk about the medical practitioner, if the person is abnormal, me or you, we will go to the doctors, okay, and they will diagnose your disease or the disorder. That all is over. Because they put that things, okay, for this particular prevention or the treatment of the disease or the disorder, you require this drug. That's all. Then this prescription is to be brought to the pharmacy. And then the role of the pharmacist will start. Unless the pharmacist will supply those particular things, we are not going to cure or prevent from the particular disease or the disorder. So if you are comparing this particular thing, yes, so it's like a triangle. And we cannot remove the one side or the one corner of a triangle. Right? So one side is a doctor or the medical practitioner, pharmacist and the nursing staff. All three are equally important for the maintenance of the health of an individual.
If I compare again the time and the duration, what do you think should be an ideal way for a student who wants to make a career in healthcare and wellness sector?
We offer a wide range, starting from the 2 years up to the, you can say like if the person is going for a diploma, 2 years, followed by the degree, then the 3 years more, and the followed by the master's 2 years more. So if you start the diploma 2, then the 3 years of bachelor's and the 2 years of master. So total 7 years. And after completion of 7 years, yes, I am definitely sure that the person doing the master's, he will have a package of at least minimum start with the 4 lakhs per annum. So that's a good choice.
How would you suggest, like, if a person should go for diploma and then go for bachelor's, or they can directly go for bachelor's if their social economic conditions and are perfectly okay?
Yeah, I prefer that the person social and the financial condition are good. That person should go for the bachelor's first.
Okay.
And the bachelor's, and if it is allowed, then the person also do for the master's.
Let's talk about the prerequisites, the eligibility criteria. So, for example, what should be the natural quality in a student that will make him or her a perfect candidate, or maybe naturally good candidate if he wants to pursue anything in pharmacy?
Yeah, so basically any persons with the 10 plus 2, that's what we are calling as higher secondary, with the science background. Either of the field of that is that person is having the specialized biology, that's what we are calling as a group B, or the maths, that's a group A, or some students are taking both, that's AP. That person can be eligible, okay, for the field in the pharmacy. That person can take the admission in the diploma, or even that person can take the admission in the B.Pharm level as well.
Yes. Right. A lot of students, when I talk about some other courses, they say that bachelor's ke baad a master's has to be done. So, for example, B.Tech is not sufficient. Maybe you should also go for M.Tech. BBA se kuch nahi hone wala hai. Maybe go for MBA as well. So, do you think that B.Pharm is maybe 1920 as compared to M.Pharm, or M.Pharm has to be the complementary for B.Pharm?
Looking at the current scenario, right, as the world is progressing at a very rapid rate, I should suggest that yes, the person should not stop his or her journey only just completing the bachelor's in the pharmacy.
Okay.
That person should also continue to do the master's as well.
The scope of pharmacy students, or how easy their life would be. Do you think that it is as easy as of a software engineer, or it is very demanding, and that is the reason why parents do not suggest this to their children?
Pharmacy is as a lavish life. Okay, because they have to work for a certain duration of hour. That's what you can say shift. Either they have person is working in the industry, or person is working into the let's say in the medical stores, or working in the formulation development department, research development. They're working on the same basis. Okay. If I talk about another thing, like let's say you give me the example of software engineer, right? So software engineer has like that what you can say, they have to design something new every time.
Correct.
Here the pharmacist is knowing about the drugs and the drug product. So if you come with the prescription, or anybody else come with the prescription, oh yeah, I know that drug because I studied this particular drug, and I know when it is to be taken, how it is to be taken. So that is like a practice, right? So in this particular aspects, yeah, the person, the pharmacist is not much having that much difficult life what you are predicting, not at all.
So I wanted to understand how much of the entire curriculum is theoretical and how much of that is practical, if I have to bifurcate into diploma, bachelor's and master's.
See, we have to well define. So let's say if you are attending, as for example, X hours of the college, whether in the diploma or even the bachelor's program, right? So we have that X hours per day has been equally divided.
Okay.
Yeah, so let's say X by 2 hours you are studying the theory, by 2 hours you are studying or the learning the practicals. Okay, the same weightage has been given to the irrespective of the whether the diploma or the bachelor's program is there. So the concept behind that, we want not only to keep the pharmacist within the four boundaries or the walls of the classroom, but we want to give the exposure, yes, within the practical aspects in the laboratories as well. So depending upon this concept, curriculum has been defined where the equal weightage of the theory and the practical classes has been given.
What is the differentiating factor between the curriculum of Silver Oak University's College of Pharmacy and the rest of the colleges that exist in India, or maybe Ahmedabad or Gujarat?
Any college within the India has to follow the curriculum which has been designed by the Pharmacy Council of India. We are already following that one.
Correct.
Apart from that, yes, we from the semester 3 we are introducing some of the new courses that has not been mentioned by the Pharmacy Council of India as a value added course that will try to fulfill the current need of the market or the current need of the pharmaceutical world. So the person starting from the, let's say, third semester to eighth semester, the person will get the 6 new things which will not be there or which is not going to be taught by any of that particular college, okay, outside that particular Silver Oak University. Apart from that, yes, we are also making the students ready in the various aspects. As for example, P for pharmacy. Pharmacy, P stands for the prescription. So we are making our students ready for the prescription concept. So any person coming with the prescription, that person, our students can guide that particular person when, how much time, or where to take the medicines, even where to store the medicine at your home, so you can get the 100% effectiveness of the medicine without the side effect. We are also guiding how to use that particular medicine safe and effectively as well. Okay, apart from that, yes, we are following, as I told you, that we are following the IKS system also. So we always prefer the indigenous Ayurvedic system of medicines over the allopathic system of the medicines. Apart from that, yes, we have the number of associations with the pharmaceutical industries, drug testing laboratory, even packaging industry, some of the basic life support providing techniques as well, sir. So we want to give the students 360-degree exposure. Okay, apart from that, yeah, mental health is also important. So yeah, we have the regular sessions by the psychologists as a part of our timetable as well. And we are having the interaction of our students maximum with the people or the community, because ultimately they are going to deal with the people and they are not trying to make them aware about the various disorder, but they are also spreading the awareness about the various things related to hygiene and how to maintain their health.
Let's talk about internships. Of course, you said that we our students can actually read the prescription and then can guide the patients like how the medicine has to be taken at in what quantity, where it has to be kept, and all sort of things. Is this internship something else, and is it mandatory, non-mandatory part of the curriculum? And when the student has to undergo the internship, and also do we get paid, because there are clinical postings that happen for pharmacists as well? So what does the stipend look like?
Yeah, so what I talked, that was regarding the practical skills we are imparting to our pharmacy students. But apart from that, yes, Pharmacy Council of India has time to time design certain hours of the practical training to be taken at a particular place. Yes, so we are following that particular thing as well. And that duration is given, let's say, after the 7th semester, 8th semester. That is a mandatory requirement. If a person is clearing, the student is clearing all the subject of the pharmacy, then he or she has to go for the registration with the State Pharmacy Council. So in this case, yes, the person has to go for that hours of the practical training at a stipulated time or at a stipulated place only. So once the person will do that one, then we will endorse that one, and that person can register as a pharmacist. Then he or she can do the practice or as a pharmacist. But whatever the things we are doing, that is, we are establishing, we are adding the practical skill. He or she may not able to get that particular step in the internship. Yes, and definitely whatever our internships are there, that is not the paid work. No, not at all. Yeah.
The duration of the internship ranges from?
Ranges in the certain hours. Let's say, as for example, 500 hours.
Okay.
So after the completion of the 7th or the 8th semester, the person has to go for the 500 hours of the training. Let's in the manufacturing area, testing area, even in the storage area, even in the sale of the distribution, depending upon his or her choice, where he or she wants to go in that particular field. So that person can do in any of that particular area as well, the internship.
We were talking about all the academic aspects of pharmacy, right? Let's also try to talk about how does the fees for this program looks like? So since we have diverse, academic programs ranging from diploma, degree, masters, and maybe postgraduate, after postgraduation as well. So how does it look like for India, for maybe Gujarat universities which are in Gujarat, and particularly with Silver Oak College of Pharmacy and Institute of Pharmacy and
Yeah,
Research?
our management has a broad vision. They started this particular pharmacy course after the post-pandemic. That started after post-corona, right?
Hmm.
So they have kept the fees very affordable.
Okay.
So we have only the 76,000. That's so 76,000 Indian rupees per year for the B Pharm program. That is the per year for the both the semester. If you
Okay.
talk about the diploma, that is a 35,000 per year because the diploma is a yearly one. So it is like affordable. Okay, and we ensure that my students, after the completion of the bachelor, they will try to earn. I will definitely make sure that they will try to gain whatever the things they invested within the first 12 months.
Since you are the Dean of Silver Oak College of Pharmacy and Institute of Pharmacy and Research, I wanted to understand what are your challenges as somebody who is taking care of the entire School of Pharmacy, from the struggles that come from the parents, the struggles that come from the students, the struggles that come from many different boards that exist in India, and of course, in case there is a struggle that comes from the management. I mean, at managerial position also, if you have some of the struggles that you want to talk about.
So to be very honest with you, I joined the Silver Oak University. I have the national and the international education, the research experience as well. So management is very much positive, and I have given the free hand for that one. The struggles what I am facing because the students are coming from the different backgrounds. So when they are gathered or catering into the first year, right, we'll have to cope up with their, all of the requirements starting from their cultural language, and we try to mold them. So my students will reaching at least to second or the third semester, they will be synchronized in whatever the mold I want to mold them, and then I want to send them out as a perfect pharmacist or the budding pharmacist. So yeah, sometimes young minds are there. So we have to understand that young minds, we like to divert them, we like to train them. Yet, but I am very honest that our students are very good. They are trying to understand the things very fast. They learn the things, but we have to show them a dream, or we have to show them a vision. What you want to be after 4 years or after 2 years. So with that particular dream, when we want to show them particular dream, we are working on that one. We are inputting them. We try to get the process. Yes, definitely the outcome will be there.
I think I had a very great discussion around the School of Pharmacy with you, Dr. Dharmesh Modi ji. And in case you have any doubt related to pharmacy, or if you want to pursue pharmacy, maybe bachelor's, master's, or diploma, I hope this particular video helped you. In case you have any more doubts left, you can just leave a comment and we'll try to understand that and reply back. And I think we will be able to solve your problems and give a solution to your problems. In case you have not subscribed to the official YouTube channel of Silver Oak University, please do so. You can also follow us on all our authentic and official social media handles. Until next time, please take very good care of yourself.